Marijuana is one of the many terms for the cannabis plant that is used as a psychoactive drug. The prohibition of marijuana in America began in 1906. In the 1970s, the United States began decriminalizing marijuana. The Drug Enforcement Agency and the FDA classify marijuana as a Schedule I drug because of its potential for abuse and its lack of medical uses. The legalization of marijuana is a highly debated political and scientific topic. Since marijuana has dangerous effects, potential for addiction, and no medical uses, should the drug remain illegal? Marijuana has many harmful short-term effects. The most apparent short-term effects of marijuana is the loss of motor skills. In the article, "Marijuana Use is Harmful," it states numerous single-dose studies that have shown THC produces a dose-dependent reduction in performance on laboratory tasks, measuring memory, attention, reaction time, and motor control. Other immediate effects of marijuana include anxiety, memory loss, increased heart rate, decrease in muscle strength, and difficulty with problem solving. Combining marijuana with driving increases risk of car accidents. In the article, "Legalizing marijuana would be irresponsible," it states, marijuana-related emergencies jumped by 86% in the 3 years from 1990 to 1993. Marijuana also has many hazardous long-term effects. Smoking marijuana can cause chronic bronchitis and pulmonary diseases. Marijuana is proven to damage the brain as well as the immune system and the reproductive system. A study taken by the University of Iowa College of Medicine states that people who use marijuana 7 times or more weekly for an extended period of time showed deficits in mathematical skills and verbal expression as well as impairments in memory retrieval processes. Regular use of marijuana can lead to poor academic and job performance as well as increased absences from work. Long-term use of marijuana causes addiction and dependency of the drug. The desire for marijuana exerts a powerful pull on those who use it, and this desire combined with withdrawal symptoms can make it hard for long-term users to stop using the drug. The gateway drug theory is a hypothesis that continuous use of drugs can lead to more dangerous drugs. Studies of illicit drugs are hard to conduct, and the results are often varied. Some people wrongly believe that marijuana is not a gateway drug. The article "Marijuana is not a gateway drug" says that during the 1980s, cocaine use increased while marijuana use was declining. Since 1991, marijuana uses have increased while cocaine use rates have remained fairly steady. This article statement is misleading because it does not show what % of cocaine users were first using marijuana. Smoking marijuana gives the user a high and is common for users to be tempted to experiment with other illicit drugs. By illegally purchasing marijuana on the black market, users come in contact with many other drugs. According to the article "Marijuana Use is Harmful," those using cannabis are 50 times per year more likely to use other illicit drugs. This statement supports the gateway drug theory. Marijuana is a Schedule I drug, meaning that it has no current acceptable medical purposes. Trying to legalize medical marijuana is another way of trying to legalize the drug altogether. Advocates of medical marijuana say that it treats glaucoma, symptoms of chemotherapy, AIDS, nausea, and loss of appetite. The marijuana affects the immune system, so therefore it would not be logical to treat AIDS. There are other more effective drugs to relieve medical symptoms than marijuana. The new drug Zofran may provide more relief than THC for chemotherapy patients. Another problem with medical marijuana is that it is very inconsistent in its unpurified form. In the article "Medical Marijuana is not an effective medicine" states that there is no scientific evidence that qualifies marijuana to be called a medicine. Marijuana is addictive, harmful, and its users can become dependent. When used, THC is stored in fat cells and can stay there for several weeks. The body is used to having the THC, and therefore users build a tolerance to the drug. In the study by Dutch nemesis of 7,000 people on the effect of dependency concluded that 1 in 10 people exposed to marijuana develop dependence, and the risk increases with frequency of use. Researcher A.J. Bundy and his associates showed that irritability, restlessness, anger, and sleep problems increase significantly on the cessation of use of marijuana. Marijuana should not be legalized because it has addictive characteristics and it has a potential for dependence.